Hello, my name is Sam Owusu, a graduate student at George Mason University. This presentation was prepared as part of Health Administration and Policy 671 in the Master of Science in Health Informatics program at George Mason University, taught by Dr. Aleme. According to the American Association of Diabetes estimate, 37 million of Americans have diabetes. 23% of US population does not know they have the disease. CDC report in 2020 ranked diabetes as number 7 leading cause of death in the United States, and, and it cost about 327 billion to manage the disease. The common type of diabetes are insulin dependent, which is type 1, non-insulin dependent, which is also known as type 2, gestational diabetes, and prediabetes. Risk factors for diabetes include obesity, family history, sedentary lifestyle, and age 45 and older. Individuals with diabetes are at higher risk of serious health complications such as kidney failure, heart disease, stroke, blindness, and neuropathy. To improve health outcomes for U.S. population, it is essential to conduct frequent screening to detect diabetes and analyze electronic health record or data to predict who is at risk of having diabetes. Estimated data from a major health care institution in the United States was used to create a database. The total number of records, including duplicates, in the stimulated database was about 17 million, and the number of unique patient records generated was close to 830,000. Diabetes was defined using clinical classification software to group ICD-9 diabetes codes. This slide shows ICD-9 codes for diabetes with complications and without complications. The comprehensive data of diagnosis in the data were used to predict the presence of or the risk for diabetes. In the SQL code, we count unique patients with diagnosis occurring more than 29 times. There were 5,270 unique diagnoses that occur at least 29 times in the dataset. These diagnoses were observed for patients who are of age 40 to 99. Gender was not taken into consideration. Obvious diagnostic predictors are diagnoses that always occur with diabetes or have the word diabetes in their name, but were not used as the definition of diabetes in the dataset. Example includes, but not limited to, diabetic neuropathy, diabetes with ketoacidosis, and diabetic retinopathy. This slide shows a few examples of rare predictors of diabetes in the dataset, namely unspecified anemia, unspecified essential hypertension, and esophageal reflux. These diagnoses were filtered from the dataset where a patient has been diagnosed at least 29 times and does not have diabetes. The 10 important predictors of diabetes include, but not limited to, major depressive disorder, chronic lymphocytic thyroiditis, and non-specific reaction to tuberculosis. Naive Bayes is used to aggregate the data from individual diagnosis to overall risk for diabetes. In the given naive Bayes formula, we calculate the probability of A, given that B has occurred, by multiplying the probability of B, given that A has occurred, with the probability of A. Then we divide the product by the probability of B. The SQL code at the top shows the calculation of likelihood ratios of diagnosis, which is then used to calculate the probabilities. In this specific example, the ICD-9 code for patient ID 101 was filtered from the clean data set. The odds and the probability for that same diagnosis were also found in the data set. The probability that this patient would develop a disease other than diabetes was high, which means the patient has a lower risk of being diagnosed with diabetes. The study was cross-validated by by setting aside 80% of the data as training and 20% as validation. Cross-validation was used to determine the appropriateness of the predictive model. The receiver operating curve is an effective tool to evaluate the quality and performance of a diagnosis test. The SQL code shows how the calculation was performed. We then subtract specificity values from 1 and plot it on the x-axis, and then sensitivity on the y-axis to generate the curve. The curve summarizes the predictors of all cutoffs. The area under the curve was also calculated to validate the accuracy of the model. The calculated area value greater than 0.5 makes the prediction highly accurate, which is better than guessing. Overall, predicted models help predict and detect a patient's risk of developing a disease, such as diabetes and its associated complications. Health informatics professionals analyze data stored in EHRs to create predictive models as a tool to forecast patient risk for having a disease. Acting on these predictions will help save lives and improve health outcomes. Thanks for listening to my presentation.